Okay, there are some chemotherapy regimens: CMF, cyclophosphamide, methotrexate, and 5-fluorouracil. AC, doxorubicin. A4, adriamycin. Doxorubicin is the other name, and cyclophosphamide. It can be added with or with added with paclitaxel or docetaxel, optional. And other regimen is CEF or CAF. Cyclophosphamide and 5-fluorouracil. It can be added with epirubicin or adriamycin. That is about chemotherapy. And next is about radiation therapy. External as well as internal radiation therapy can be delivered. So external radiation can be given as a whole breast radiation treatment, 5 days per week over the course of about 5 to 7 weeks. Total dose 40 to 50 gray can be delivered. In case of brachytherapy, it can be done with the help of two methods: multi-catheter method as well as balloon catheter system. So I will arrange the video of this multi-catheter method and balloon catheter system. So multi-catheter method is done with the help of a device, SAVI, and the device is having a bundle of catheters. So this bundle can be expanded uniformly, and through this catheter, small radioactive seeds can be placed inside or near to the tumor. The seeds are commonly left for 5 to 10 minutes only. The other method is balloon catheter system. Here a balloon tipped catheter is being placed, and we can insert the radioactive seeds with the help of a computer controlled machine. And finally, the surgical management, most commonly done management, mastectomy. It can be done by modified radical mastectomy, radical, total, skin sparing, nipple sparing mastectomy. Other type of surgeries are sentinel lymph node biopsy or resection, axillary lymph node dissection, breast conservation surgeries or treatment, breast reconstructive procedures, or breast reconstructive surgeries. So many surgeries are there. I know you have studied all these things in second year. First one is modified radical mastectomy. It will always come as a differentiate of modified radical mastectomy or total mastectomy. Anything can be asked. So here modified radical mastectomy is what we are doing. So here we will be removing the entire breast tissue, including the nipple areolar complex. In addition to that, axillary lymph nodes are also removed. But here pectoralis major muscle as well as pectoralis minor muscle are not removing. But in case of radical mastectomy, we are removing the pectoralis muscle and major as well as minor muscle. So here you can see the difference. This is the radical mastectomy and this is modified radical mastectomy. Here you can easily find out the pectoralis major and minor muscle. So why we are sparing this? If the patient is expecting a reconstructive surgery after the total mastectomy, this is being spared. So radical mastectomy, it is also known as Halsted mastectomy. So in this procedure, the entire breast, the axillary lymph nodes, the pectoralis major and minor muscles, everything is being removed. So it is recommended when the tumor is extended. Total mastectomy is also termed as simple mastectomy. Here, axillary lymph nodes is not being taken. That is a difference. This is done in non-invasive type of cancer. It can also perform as a prophylactic treatment. It is done along with sentinel lymph node biopsy. We can do sentinel lymph node biopsy, but we are not doing axillary lymph node biopsy or dissection. What is sentinel lymph node biopsy? We will study in next slides. Other surgeries are skin sparing mastectomy. Here, the breast tissue is removed through a small opening, and we will preserve most of the skin. It is not done in the patient with skin cancer. Okay. Nipple sparing or subcutaneous mastectomy. Here the breast tissue is removed, but the nipple areolar complex is preserved. That is also can be done. Other type of surgeries are breast conservation treatment. Here the main goal is preserve the non-affected part of the breast. For that we can do a lumpectomy. In this only a lump is been removed. Wide excision, otherwise partial, segmental or quadrantectomy can be done. Next comes the sentinel lymph node biopsy and axillary lymph node dissection. This can be come as a differentiate question. Okay, so what is sentinel lymph node biopsy? Here, the first node in the lymphatic series which drains the tumor, that is sentinel lymph node. So sentinel lymph node means it is the first lymph node in the lymphatic series which drain the primary tumor. So this can be identified by injecting radioisotope or dye, and we can use an ultrasound probe and we can easily find out the sentinel lymph node. A typical axillary lymph node generally involve the removal of 12 to 20 nodes. Axillary lymph node dissection means 12 to 20 nodes is been removing. Some of the differences. So sentinel lymph node only 15 to 30 minutes is needed for operating, but here it needs 60 to 90 minutes. No drain is needed after this biopsy, but after the dissection of ALND, drain is needed. Here local anesthesia, but general anesthesia. Lymphedema only 8% can be expected, but in axillary lymph node dissection, we can expect about 30%. This thing is almost similar. Decreased range of motion may occur, but here decreased range of motion will be there. Seroma will not be there, but seroma usually occurs. So these are the difference. This also can be asked as a differentiate. And next comes some of the reconstructive procedures after mastectomy. So some of the women will be having psychological problems or upset after removal of the breast. For those patients, we can go for these surgeries. One is tissue expansion followed by permanent implant.